Hi everyone, Dr. Houghton here. I wanted to alert everyone that as of yesterday, October 1st, 2025, Medicare, or more specifically the Centers for Medicare and Medicaid Services, also known as CMS, is no longer covering most telehealth or telemedicine visits with your doctor or provider. However, most private health insurances are still covering telehealth visits. Just check with your insurance provider to make sure they are still covering these types of visits. Now, there are some exceptions with Medicare, including if the patient is in a rural area and at a qualifying medical facility for the visit to be covered. In addition, telehealth visits for some conditions are still being covered by Medicare, namely mental and behavioral health disorders and home dialysis patients, with some possible stipulations. Coverage for audio only or telephone visits without the video component had expired previously. A limited exception includes if a patient is in their home and cannot use video technology, but the provider is able to do so. Medicaid coverage, which is separate from Medicare, for telehealth services is determined at the state level, with each state having its own specific rules and coverage guidelines. Where I am in Ohio, coverage is still intact for telehealth services under Medicaid. The good news? Since the majority of medical practices offer telemedicine services, around 75%, I am confident that CMS will reinstate coverage of these services once the government shutdown is resolved. In which case, coverage of telehealth services is likely to be retroactive to October 1st, 2025. Be well, everyone.